In the last decade, there's been an explosion of consumer-directed wearable devices that can help them monitor certain health conditions. And while that explosion of technology is great and that interest is great on the patient side and the clinician side, we need to understand more of how to really utilize it clinically to make the best use for the patient, but also to help the clinician make decisions that'll help improve the life of the patient. I'm Laxmi Mehta, and I'm a preventative cardiologist at The Ohio State University Wexner Medical Center. Lately in my clinic, I've seen more patients starting to ask about their wearable devices. So some of that may be watches or rings that they've used or even pulse oxes that they have at home. And they're asking, what does this data mean? Or I'm experiencing this. Can you look at what the output of this device is? And it's kind of empowered them to take things beyond our office visit to try and understand why they may be feeling something or why they may not be experiencing what they would like to in terms of sleep. And so they come and ask me, what should I do about this? These wearable devices that patients have can help in several different ways. Like if it's some of the rings can kind of tell them what their heart rates are like, how their sleep is impacted, how much sleep they're getting, how deep that sleep is. Some of them can even tell about body temperature. So are they starting to get sick or not? Watches can look at heart rates, look at step counts, and that's where the industry first started, was on step counts. And now the watches can even look at your heart rhythm and give you simple EKGs. There's other devices that the patient doesn't necessarily wear, but they can just touch their fingers to at home, and it can give you an EKG even to tell you what your heart rhythm is doing at that time. So the accuracy of the devices really vary. Not all of them are FDA cleared, and so that can be problematic and why you have to use it with the caution and share it with your clinician. So I've had some patients that have come into the office and it has indicated that they might be having an extra heartbeat or an early heartbeat, as we like to call it, that makes them feel certain ways. I've had some patients that have shown me on their device that they have atrial fibrillation, and so what they're feeling is real and then we need to alter their medications. And then for some patients, it's been helpful for them that when they feel something, they're reassured that the rhythm looks okay. I've had other patients that have said, now I know why I'm having so many palpitations. I'm not getting enough sleep, or it's not deep enough sleep. So now I'm working on that. So some patients have even said that when they were right before they were getting COVID or some other illness, they noticed that their ring was telling them that their temperature was creeping up. So it's been interesting to see those little tips that patients can see in themselves before they actually surface to our office. Now, one thing I do want to warn people about the wearable devices is the wearable devices will not detect if you're having a heart attack. So if you think you're having a heart attack or stroke, you really should just be calling 911. Sometimes patients wear our heart monitors and they might wear it for 30 days or a day or two, and we don't catch anything, and the patients are always frustrated. And when they have these devices, whether it's a watch or another device where they can put their fingers on and catch an EKG, then they have a little bit more sense of control of like, I didn't have it when I wore the monitor, but I'm feeling it now. Let me capture it. And it's funny thing is we do capture things on those that we might have missed on a monitor because it wasn't worn long enough.